So now we're going to do nose, mouth, throat. So one of the things that you want to inspect is you want to look at, again, the patient's face, and you want to look at where their eyes and eyebrow distribution is, as well as their nose is centrally located. One of the things that I want to do is at this point, I know you all love wearing gloves, so I'm going to actually put gloves on for this part of the exam because I will be touching her nose. But we want to make sure the nose is symmetrical. We want to know that it's patent. We want to know that it's proportional to the features of her face. We want to know that there's no moisture on it, no open wounds or lesions. So again, she has scattered macules, and that's it. So I'm going to touch your nose, okay? I'm just going to close one nair with a little bit of a pressure on a finger and have you, can you breathe in and out for me? And out. Great. And I feel a little bit of air through that nasal passage. And then again, I'm going to do the other side. And out. Out, please. And out. There we go.
I'm
and
sinusy. You looked at my ear. You know this.
I know you're sinusy.
My allergies.
There's no
spring.
patency on the left side of her nose, and that is completely fine. Let me lick my gloves. Okay. So with that, now I'm going to inspect the nasal cavity. So I'm going to grab this, and again, a new speculum, and I am twisting this on. Remember to wrap the cord. And I'm just going to take a look up her nose. I want to be very clear. You are not shoving this up patients' noses. This whole speculum does not go up the patient nose. It's just the tip, and you're just looking up. So if you want to have the patient look up, you want to put one hand right, or your finger right at the end of the nose and other on the forehead to hold the patient's head in place. Again, gently place this at the opening, and you're just looking. She has red turbinates, a little bit of pinky moisture. And that is all completely normal. Your right hand side, though, is very swollen with red, beefy turbinates. So what's happening is the nasal passage is looking a little red and tender, but red is actually normal. It's when it gets beefy red or angry red, we want it to be a little red. Beefy red is where it's a little bit upset. Hers are a little upset because her sinus on her right side is a little full. So that is actually considered very normal with the current weather that we're having. Today happens to be a cold and rainy day. Okay, I'm going to hang this back up because you don't want to wear out the light bulb.
And I'm going to put allergies.
This. Yes, and you're not using your Flonase. No, I didn't think so. Very normal as nurses. I'm going to go to your mouth because I still wear the gloves. We'll go back to the sinuses in just a minute. I'm going to take a
tongue depressor,
and I'm going to just use this and look in her mouth. One of the things that I will do, though, is I will take this tongue depressor, and I'm going to, again, grab the light, come around. You can also utilize your pen light. None of this apparatus is going to be going into the patient mouth. None of this goes into the patient mouth, just the tongue depressor. So I'm going to have you open up for me and say ah. Stick your tongue out at me. Okay? And she gags.
And I'm a gagger.
You look at the uvula in the back of the throat. You want to see it vibrate. That is actually, if you go and the uvula, it's and the uvula moves. That is actually cranial nerve number 10, which is
what?
What?
I wasn't ready for that. Hypoglossal.
Cranial nerve number 10. You guys can all look up that name.
And the Olympus towering top of Finn.
It's hypoglossal.
Yeah,
it's hypoglossal.
It's hypoglossal.
But I want to make you look something up. And then I'm just going to take a quick look around. I'm looking at her mucosa. I'm looking at the frenulum underneath the tongue. And I'm looking to make sure that there's no skin breakdown, anything like that. I'm looking at the upper palate. And that is it. Okay? I'm going to then grab my handy dandy gauze. And I'm going to have you stick your tongue out again. And I'm just going to palpate your tongue. Any pain, tenderness, anything like that. It feels solid, normal consistency. It should feel like almost like a piece of chicken that is cooked. The consistency of a piece of chicken that is cooked. Again, if you're in my lab, you know I ruin food. If you're not, again, I'm very sorry. Okay? All right? So now I've done that. Her lips are also moist. She does have some minor cracking on the inside corners due to dryness and probably making sure that she's staying hydrated enough and wearing a chapstick with the current weather that we are having. Okay? Now we're going to go ahead and palpate the sinuses. And I'm going to palpate here again. These are the maxillary sinuses. No. Yes. Maxillary sinuses. And these are the frontal sinuses. Any pain, tenderness, you're a little swollen here.
Yeah.
That's fine. Okay. And then what I did not say is when I was inspecting the throat and looking at the throat, I did see the uvula. I also saw her tonsils. They were at 0 station. So you're going to want to look in your textbook where it's 0, +1, +2, +3, and then +4. They're actually touching in the back of the throat. You want to look for pustules. You want to look for any pus pockets, any drainage, anything like that. There can be tonsillary little crusts, and those are normal. They actually just chip off and you send them off and they're completely normal. They're not a sign of infection or anything like that. So now I'm going to go back. I did the sinuses. I did everything. We looked at the uvula. And then I'm going to have you go and stand up.
Okay. Before we stand up and do the Romberg, I have another little helpful hint. When you are looking in someone's throat like mine, who is a gagger, if you can't get in with your tongue depressor, if you actually just ask them to take a really deep breath through their mouth while you're doing it, it actually opens everything up so you can see as well.
That's awesome. Okay.
So just another helpful hint for us gaggers.
Yes, great. Thank you. Appreciate
I don't
that.
use tongue depressors because of it.
Then
if I can't get in, I'll go in with a tongue depressor. But because of my gagging,
because you're empathetic
I'm
to
empathetic,
gaggers.
and
yeah.
I'm an empathetic gagger.
I'm not a gagger.
Wow, it's like sweet confessions.
I know, right? Ooh, sorry. Okay, so we are going to have you go ahead and stand up to do the Romberg. I'm very particular about the Romberg. The reason is I'm going to have you walk forward so that they can get this on film, is that I'm actually not worried about the patient falling. I'm more worried about your stance behind the patient. So I'm going to stand behind my patient. The patient's going to stand with the Romberg. Her hands are going to be facing forward. I call it mountain pose in yoga, from yoga, so if you recall that. But one of the things that you want to do is you want to put 1 foot between their legs, not all the way, but just 1 foot right here. The reason is that I want you to be prepared if they fall. So if for any reason they start to fall, your knee needs to be bent, this needs to be stable, and you need to be ready to touch them and help them and guide them to the floor. Okay? This is not for you to catch them and break your back. This is for you to help guide them to the floor. So the way that Romberg is done is I'm going to have you go ahead and close your eyes, please. And you have them hold this position for 30 seconds. You're looking for any wavering, any type of stumbling, anything like that. As soon as you notice that, you want to tap them, have them open their eyes, and then you hopefully are not guiding them to the floor. But you really want to make sure that you're in the correct position to correctly catch them and guide them to the floor. Okay? Her Romberg is negative. We're going to show you a positive Romberg. We're going to flip spaces, and I'll show you what a positive Romberg looks like, because I fail my Romberg.
Really?
Yes.
Oh.
Okay. So she's going to stand behind me. She'll let me know when she's ready.
I'm ready.
Okay. I tend to go this way.
Okay.
Okay.
Yeah, sure.
But I have constantly failed my Romberg.
Okay, close your eyes then.
I'm sorry, I'm going forward this time.
Yeah, you are. Okay.
Okay.
It's a weird pose.
It is a weird pose. Anyway, so my going forward is a failure of the Romberg, and for some reason it's been typically normal for me for the past 15 years. I've failed it. So there you go. And my brain scans, I know you don't think so, but my brain scans are normal. Thanks. Okay, we'll see you shortly for another one. Bye.